A common complaint in our industry is that healthcare providers are often being asked to do more with less. Increasing regulations and ever more numerous technology offerings can often seem overwhelming to large and small practices alike. More tasks require more tools to complete them, more tools require more staff requires more money, and that one means more tasks, and you get the idea. Some out there, though, are finding their way out of this spiral by using those same regulations and technology to their advantage. I'm Adam Solati, and welcome to this edition of the eClinicalWorks podcast, coming to you from the National Users Conference in Orlando, Florida. We're here to speak with Dr. Mark McNeil, physician and owner of Trillium Family Medicine in Asheville, North Carolina, who's actually doing less and getting more out of his interactions with his patients. Dr. McNeil, thanks for being here today.
I'm happy to be here, Adam.
So you're a longtime user of our software, Dr. McNeil. How were you first introduced to eClinicalWorks?
Sure. Well, I was in group practice for a number of years before going solo with Trillium Family Medicine 2 years ago. And the group practice I served in, at first, I became the physician champion for transitioning from paper to eClinicalWorks way back in 2008. And had a good experience with that. And of course, once you become the physician champion with the electronic health record, you get involved with a lot of different things, including the business side of medicine and quality measures, meaningful use, patient-centered medical home. After taking that practice from paper to eClinicalWorks in 2008, I was then recruited by another practice to come and be their IT physician champion and take over some of these meaningful use and patient-centered medical home measures. And so really transitioned from that practice to another practice where I was really helped them use the eClinicalWorks better and function as a super user there.
So you were a part of an initial implementation for eClinicalWorks. You then became the physician champion at another practice, and now you have your solo practice. And what sets Trillium apart?
Well, Trillium Family Medicine is unique in the fact that it's a low overhead, patient portal-based practice. Well, what does that mean? It means that we run our entire workflow. We run our entire workflow through the patient portal. We train our patients to schedule their own appointments using the patient portal rather than calling on the phone. We train our patients to seek clinical advice through the portal rather than reaching out by a phone call. We train our patients to receive their lab and diagnostic imaging results through the portal rather than the traditional ways of phone calls and letters. We also use the portal heavily for patient engagement, things like web interviews prior to the appointment. All of this really streamlines our workflow. At the end of the day, this means I can practice with less staff. If you spend time in our office, Adam, our phones really don't ring all that much because when a patient needs an appointment, they're going to the portal and doing it themselves. When they need clinical advice, they're going to the portal and sending me a secure message instead of calling. When our phones don't ring all that much, I don't have to hire as many staff to answer those phones. The average family physician employs 4 to 5 full-time employees per physician to support them. With this patient portal-based workflow model, I'm able to run my office with just one full-time medical assistant and a part-time office manager. And so this significantly reduces my overhead. And the beauty of that is I don't have to see as many patients during the day.
All right, so you run a lean practice, essentially.
Yes.
How efficient is it?
Well, I mentioned the reduced number of employees. I went from about 4 full-time employees supporting me now down to 1 full-time employee and a part-time office manager. I don't hire a scheduler, and so previously I was having to see around 20 to 25 patients a day to meet overhead and then take home a reasonable income myself. Now I'm seeing about 12 patients per day. So my break-even point before was probably around 12 to 14. Now my break-even point is around 6 to 7 patients a day. So I don't have to see as many patients anymore.
Let me get this straight. So you are able to reduce your patient load by 50% or more over other traditional practices and still meet your overhead and make ends meet.
I mean, that's correct. You know, the technology has come so far now. Historically, you know, doctors practice an environment, well, maybe not in the past decade, but in previous decades, there was a lot of money going into healthcare, and you could run an office with many employees and fairly inefficient workflow and still make a reasonable income. Well, those days are long gone, but unfortunately, those same workflow processes are still in effect. Traditional phone call workflows and letter workflows, but the technology has come so far, and very few physicians are making the most of it. But the portal provides so many opportunities.
Let's talk about some of your workflows. You're saying that some of the other workflows are inefficient. Let's talk about some of your workflows, and more specifically, what are some numbers that we could go by? I mean, you know, in terms of usage.
Sure. Well, let's first start with appointments. We train our patients to schedule their own appointment, and at this point we have 75% of our appointments being made by patients on the portal as opposed to calling or walking in. So only 1 out of 4 patients needs any type of assistance with an appointment in my office. 3 out of 4 are doing it themselves, as opposed to a traditional office where most appointments are brokered through a receptionist, the help or hindrance of a receptionist or a medical assistant. And you're paying those receptionists and medical assistants $16 an hour or more plus benefits to do that. That's fairly expensive. In the portal, I mean, there's no extra cost in the portal outside of my monthly fees to eClinicalWorks. It's my, you know, but that doesn't cost me anything for the patients to schedule.
Right. Now your website, let's talk, you know, speaking of the website and patients using it, your website says you are accepting new patients.
That's correct.
Running your practice this way, has your target panel size decreased along with your schedule load?
My target panel size has decreased. I needed to fill up my schedule. I needed probably 1,800 patients before, and now I'm practicing with about 1,000 patients. So my total patient volume and panel size has definitely decreased with this model.
Well, it seems like you have plenty of concrete evidence that this model actually works well for you and for your patients. We're going to come right back and we're going to hear more from Dr. McNeil about how to put this into place for your office.
Over the coming year, you will see Hilo revolutionize patient engagement by reaching patients where they are with their smart reminders and automated communication. Leading the way is the Hilo app, a logical extension of the practice's portal, at no extra charge to you or your patient. 200,000 patients have already downloaded the app. Patients are hungry for better, easier communications with their doctors. Hilo will make patient engagement easy and natural for you, marketing your patient while increasing patient compliance and satisfaction. It's so easy to use. No special activation or configuration is necessary on your part. Your patient simply downloads the app and starts accessing the information you share with them via the portal by logging in with the same credentials. Hilo can help your patients manage chronic conditions, help them to improve their medication compliance, reach them where they are with the smart reminders and automated communication, and make getting an appointment to see you easier. Help your patients help themselves to online health and wellness with Hilo. Find more information at my.eclinicalworks.com.
Welcome back to this episode of the eClinicalWorks podcast. I'm Adam Silati, and I'm speaking with Dr. Mark McNeil from Trillium Family Medicine. Now, Dr. McNeil, we're looking at your situation, and you had the luxury of opening your practice with a fully electronic-based mindset. Now, other practices might feel that they don't have that same opportunity because they're trying to manage their existing workflows and implement new tools to get patients on board and also get patients on board. So let's get into some specifics about how we can help these practices that are kind of contending with some of those things. You mentioned that a large number of your appointments are made through the patient portal, and this is, I think, a large departure from what's normally expected. So how do your patients feel about this?
Well, I answered the last question first about how my patients feel about it, and then maybe I'll get back to what a traditional practice can do to start transitioning this way. The patients love the real-time scheduling. It decreases a lot of anxiety. I mean, if you take an acute visit for a new complaint, for example, generally, most of the time the patient decides they want to come in the night before, but they'll spend that night worrying, am I going to be able to get in? What time is my appointment going to be? How am I going to plan my day? Well, and they may even, and that generates a lot of anxiety. That can result in a phone call to the physician, and so many of our calls after hours are just anxiety about are they going to get the care they need. But in this model, patients don't have that concern. They decide at 1 o'clock in the morning they want to be seen the next day. They log on to the portal, grab an appointment, go back to bed. They know they're going to be seen. They can plan the rest of their day. You can actually, eClinicalWorks allows you to see at what time the patient scheduled the appointment. It's amazing how many next day appointments are scheduled at 1 o'clock in the morning, 2 o'clock in the morning, 11 o'clock.
It's more like a same day appointment at that
point. It's the same day appointment. You're exactly right. But just last week, I had a guy who had a pretty bad headache. He has a history of migraine headaches, but he was having one that was a little worse than usual, and he's the type of patient who probably would have called about that. He was in a traditional model, but he scheduled an appointment about 10 o'clock, was able to take some medicines, relax, go back to bed. He knew he was going to be seen first thing in the morning. He got the first appointment in the morning, and he was really appreciative that he could do that and not have to wonder if it's going to be days before he gets in.
Something just occurred to me because about the after hours thing. A lot of practices will contract another physician to be on call or have some sort of a service that they have to use to be on call for those after hours things. Do you still use something like that just in case of emergencies, or what?
No, I take my own call actually, and that freaks a lot of people out. I'm sure some people who are watching this right now are going, what? Well, here's the thing. My patient panel is smaller, so that's a few less calls, but when you commit to giving good service on the portal, such as making sure those same day appointments are there, that decreases patients' anxiety quite a bit. Like I said, for acute visits, they know they can get in. My patients don't really worry about, am I going to be able to be seen? So they're not calling as much after hours for that. We make a point to respond to clinical advice questions through secure messaging rapidly. Our goal is to get back in touch within 2 business hours. So many times if a patient has a concern in the evening, instead of calling me, they'll send me a message because they know they're going to get a response from me first thing in the morning. So that really decreases patient anxiety. So back to your question about call, I don't get that many calls. I get around 4 after hours calls a month. And generally those patients really should have needed to call. The questions about anxiety, nobody called me back, nobody wasn't able to get in today, those type of calls don't happen anymore.
How many appointments do you need to publish to meet the patient's need? How do we know what the right number is?
Right, so we're going to go back to some statistics here. So if you were told there would be no math, you were told wrong. You were told wrong. So generally what we do at Treating Family Medicine is we calculate the average, what our average appointment need is. And generally that's about 12. Then we also calculate the standard deviation. And our standard deviation is about 3. Okay. So if you remember from, this is where we get into some advanced statistics.
That's kind of the average, when you take the average, that's the average amount of difference that you might find, right? The standard deviation.
Generally correct, yes. If you go 2 standard deviations from the mean, which for us would be 18, that's going to represent about 97.5% of your days. So if we publish 18 appointments to the portal, we know we're going to likely meet the needs of our patients 97.5% of the time, same day. Now, just for that wiggle room, we go ahead and publish 20.
It's a nice round number.
Exactly. Now, I'm a smaller office, solo. Bigger, even in my office, we have fluctuations from day to day, such as Monday tends to be a busier day. And in bigger offices, that fluctuation may even be higher. So if offices choose to do that, I encourage them to maybe even do the mean for each day, because your need for same-day appointments is going to be higher on a Monday than, let's say, a Wednesday.
And you were generous enough to share some information about how you calculate that standard deviation, and we'd like to share that with the people who are watching the podcast. We're going to put up some information at the end of the episode so that you can learn exactly how you would calculate your own standard deviation and put this into practice for your office. So one fear that I've heard a lot from offices is that their patients, if they have these on-demand appointments, these appointments through the portal, that the patients are just going to take over their schedule. Has this been an issue for you, and what did you do about it?
Well, I'm going to address that from the scheduling standpoint, but I might just address it from the secure messaging standpoint too, if that's all right, because a lot of clinicians really worry about, feel that they're going to get overwhelmed with secure messages too. But let's start with the scheduling function. So in general, we address that, we make sure that goes well with two different strategies. First, we keep it simple. We're really big with the keep it simple, stupid idea, the KISS principle at Trillium Family Medicine. So the appointments we publish to the portal, we only publish one type. Within the patient portal, you have to select, when you're a patient and you're scheduling, you have to select the type of appointment you want. Well, we only put one that they can select. It's called office visit, okay? And it's generally, they can pick a 20-minute slot. We don't publish well child visit, sick visit, new patient appointment, procedure note. You know, these are all types of visits that you can have within eClinicalWorks. We don't put those out there. We keep it simple, because patients, if they have too many options, that will confuse them. They'll get frustrated, and you know what they'll do? They'll call. Okay.
And then you've broken all that work that you've done.
And then all that work we've done, we're kind of losing the efficiency gain. So we keep it. We make sure it's easy. I mentioned before, we train the heck out of them. Okay, at their first visit, every new patient gets a thorough orientation on how to schedule your own appointment, and we make sure that they feel comfortable doing that by the time they leave. Now, sometimes everybody wants to come in on the same day, right? And then some days everybody wants to come in for their physical right behind each other, and so you get 3 physicals scheduled in 20-minute slots. You know, having to see less patients, those moments are less, but they occasionally happen. So what we do as part of when we start the day at Trillium Family Medicine is we have a staff huddle, my medical assistant, my practice manager, myself, and we look on our schedule screen to see what has appeared. And we'll do our best to make adjustments if we see somebody's going to need more time, or things are or things are getting clogged. That may mean blocking out some appointments around a patient that needs more time. That may mean scheduling some catch-up time later in the appointment day. Very rarely do we have to ask a patient to move. That, you know, occasionally, you know, maybe once every couple months we have to move a patient around, but that's generally, we don't have to do that. We can.
Do you call them for that, or do you send them a message to the portal?
Well, it depends. If this is about 80% of our patients are using the portal as their primary form of communication, and we know that if we reach out to them this way, they get the message. So they're part of the 80%, we'll just send them a portal message because we're generally confident they're going to get it. And then if we don't hear from them, we'll call them. You know, we have a certain number, about 20% of our patients just aren't on the portal, but again, they wouldn't have scheduled on the portal to begin with. But
true.
But yeah, so there are some patients we still need to reach out to by phone.
Now, where does the patient portal questionnaire come into play?
Okay, we use this product called Instant Medical History by a group called Primetime Medical Software, and many eClinicalWorks users may or may not know that eClinicalWorks has an interface with this product.
Right, it's built right
into the portal, and it's called the web interview. And it does require a sales ticket to turn on. There is a $15 charge per month to use it, and I have no financial interest in this product, but I am a big fan. This is a pretty sophisticated product. It has about 70,000 questions, and it uses branching logic to give a patient a personalized questionnaire based on their chief complaint or chief complaints, because they can put more than one in. We train our patients to do this before every appointment. They can select from a list of 30 common chief complaints to choose from, or they can type in what they want to talk about that day, and the software is sophisticated enough to start a questionnaire. It's kind of like sort of having a third-year medical student in the office. Frequently, the histories are really good. Third-year medical students take good histories. Occasionally, it goes off in la-la land and starts asking questions about syphilis, and you're like, it's not syphilis. But generally, the histories are very helpful. It's great on many levels. It helps the patient, engages the patient in their own care, gets them organized in their thoughts before they come in to the office. And they get their thoughts out there. This is great for patients with a lot of complaints, patients with chronic pain or fibromyalgia, or patients who have multiple chronic medical conditions. They just get it all out there. It's also great for our office in that it's great for pre-visit planning. As part of our huddle again, in that morning, we review the web interviews that come in during the day. And that gives us a good idea about what we're up against, where we have a generally good idea whether this is going to be a pretty focused, easy visit or whether this is going to be more complicated and maybe we need to block out some more time for that patient.
Do you have trouble getting people to actually fill out that web interview? I mean, is it a burden for them, or is it easy, and how do you manage that?
Good question. The things we get the most bang for our buck on are the real-time scheduling and secure messaging. And honestly, if you get good service on that, patients take to that quickly. The web interview, that's probably the most challenging of the three, between real-time scheduling, secure messaging, and the web interview. You get some pushback at first because people don't want to do their homework. They don't want to have to fill out a questionnaire before they come in. That's what you're
for, right? I mean,
right. Aren't you going to ask all the questions and do this? Yes. So we spend time that first day talking about why this is important, making sure they know how to do it. Frequently, patients will come in and they haven't done it, and that's okay. We have a PC terminal in our waiting room. We also have PCs in each exam room, so we'll give the patient time to complete it before they do it. So, the beauty of that is that it gets them back on the portal and using the portal and getting more comfortable with it, so they're more likely to do it the next time. They also see that we're serious about it, like, no, we really do want this.
No, you're going to do this.
Yeah, no, this is important. Yeah. So that does take a little more encouragement and a little more training, but it's worth it. I mentioned the pre-visit planning and the patient engagement side of it. It's great for documentation as well. We upload the results from that to the subjective portion of the note, and probably half the time that's done, I don't need to add anything more than subjective is just done. And all I have to do is document the exam and the assessment and plan. That's a huge time saver. It also keeps me from having to turn and point and click and type while the patient's in the room. I can sit just like this, focus on eye contact, and focus on open-ended questions in the patient's narrative. And I usually come in and say, gosh, you did a really good job with that web interview. Thanks for doing that. You gave me a lot of good information. Sounds like your knee hurts and your asthma isn't going very well. Tell me more about that.
A little positive reinforcement, and probably, I know you're a PCMH practice, I think level 3, right?
Correct,
is that
yes.
correct? So, and knowing a little bit about the PCMH program, a lot of it is engaging the patient, making them feel like part of the care team and taking some responsibility. So I'm sure this goes a long way to helping with that. Any trouble with logins? You get a lot of login requests or help for assistance on that?
Putting that time in with that new patient visit to make sure they're comfortable with it goes a long way. So we don't have as many as you think, but yes, it happens. And we prioritize when patients send us an email saying I'm having trouble logging in. We jump on that pretty quick and make sure we get them back up and going. So that's set as a high priority task for my medical assistant and my practice manager. But what's good about the web interview is that they have to log in to do it. So let's say they come in, they walk in for a visit. Let's say they're having trouble with their portal account. They walk in for a visit, and we do take walk-ins as well. And so we sit them down to do their web interview. If they're having trouble logging in, we fix it right there. So the web interview gets them logging in again and comfortable with their username and password. So it's good reinforcement, and the username and password is less of an issue.
I know that one of the most common objections that I've heard when I talk to people about the patient portal is that their patients won't use it or won't know how to use it, but it seems like you found a really effective way to mitigate that issue.
It's fairly simple. It's good salesmanship. You got to sell the heck out of it, meaning, and that's part of that training, making sure they know it. And then you got to follow it up with good service. You get in eClinicalWorks, you get clients with good salesmanship and you keep them with good service, right? It's the same in medicine. If you're going to change behavior, you got to sell the portal, and then we make a point to follow it up with good service, meaning when they go look for an appointment, they can get one within a reasonable amount of time. When they send me a message on the portal, they get a response in a reasonable amount of time.
When we come back, we'll get some specifics on how to set up that electronic questionnaire and why electronic messaging might be the best tool you have for running an efficient practice. Welcome back to this episode of the eClinicalWorks podcast. I'm Adam Salati, and I'm speaking with Dr. Mark McNeil. We're here at the National Users Conference in Orlando, Florida, and we're talking about how he runs an efficient practice using Patient Portal and some of the tools that are associated with that. So, Dr. McNeil, I really want to know, how did you build your questionnaires? I imagine you might have spent a lot of time mapping structured data or working on that. Tell me about that.
Well, with our use of this medical history product, that takes care of most of our questionnaires, actually. So I haven't spent all that much time building questionnaires because I get what I need from that.
And I know that with those questionnaire designers, I'm sorry, not the questionnaire designer, the IMH,
yes,
there's settings for that as well. You can set sliders for how intensive you want that to be. How did you figure out where you want that to sit?
I did reach out to Primetime Medical Software, the makers of Instant Medical History, and they actually will, answer the phone and schedule webinars with you to make sure you know how to use the product well. And they were able to advise me on common settings for primary care offices. Generally, and it's not complicated, you can change the settings for various different categories, from 0, meaning the patient gets no questions, to 10, meaning they get every single medical student question in the book. And for primary care, they recommend shooting down the middle for most. So I started with every setting at 5. And so over time, I've tweaked them to my liking. There's some I haven't gone above 5 with anything, but I have turned a few of them down to 2 or 3.
I imagine once you get some of those questionnaires coming back, you get a much better idea of how they work and what you want them to do.
You start seeing it when you're getting information that's too much or not necessary. Yeah.
Did those questionnaires do a good job of getting information from the patient?
They do. It's sort of back to the third-year medical student analogy. And generally, the histories are really good, and they ask questions that, just being a human, that I sometimes forget to ask. One area that this product does a really good job with is drug abuse. The computer always remembers to ask about that. It's programmed to. Sometimes I get distracted with the chief complaint, what's going on, and I forget to ask about alcohol use or follow up on somebody I know who's might have an issue there. It's amazing how many alcoholics that have been picked up by the web interview that I might have missed because, number one, the product asks the patient when it might have gotten missed, but number two, patients, it's amazing how they'll share freely with a computer how much, what products they're using and how much. And then I say, gosh, wow. And I frequently pin that on the computer. I'll say, gosh, thanks for doing that web interview. You did a really good job with that, Adam. Computer says there's an alcohol issue we need to talk about. Is that right? Do we need to talk about that? And so it's not me. It's the computer doing it. So it does a pretty good job.
Now, I read an article recently stating that a major part of the patient-physician relationship is not really that the doctor can get input from the patient on things that are clinically important, but that a big part of it is that the patient has the ability to actually communicate with the physician and feel connected to them and talk about whatever's going on. What are your thoughts on this?
I think that article is spot on. There's so many strengths about getting information from the patient ahead of time, but at the end of the day, this is all about relationships, Adam. I mean, I think that's what that article is getting at. When a patient feels like they are being listened to and that they have good communication going on with their physician, you're naturally going to have better outcomes. Patients are going to be more compliant. They're going to trust you more. Getting those type of relationships takes time. And if you can streamline your workflow, lower your overhead, you're going to have more time per patient. And that's the best benefit of using the portal as much as you can. Sure, it's great for making meaningful use in patient-centered medical home, but if it can, where you really hit pay dirt is when it lowers your overhead and you can spend more time with the patient and develop that relationship. The accessibility is a big part of that too. when patients know they can get an appointment when they need to see you, that they're not having to jump through barriers and hoops to see you, when patients know they can reach out to you for clinical advice and get a prompt response, that only enhances your relationship, and it's going to lead to better outcomes in the long run.
Dr. McNeil, thank you so much for all of your information here today. It's been a pleasure speaking with you. I'm Adam Solati. Thank you for joining us for this episode of the eClinicalWorks podcast. If you'd like to see more, we have other episodes posted on our YouTube page, and you can check us out on iTunes. Please don't forget to leave a comment. We want to make sure that you're part of this discussion. Thank you, and we'll see you next time.
This broadcast and its contents are the sole property of eClinicalWorks and are protected by federal law and international treaties. You are strictly prohibited from making a copy of, modification of, or form of rebroadcasting or re-encoding this broadcast without prior written permission from eClinicalWorks Public Relations, except as may be permitted by law. This broadcast is provided for informational purposes only. It is intended as a personal, non-commercial use. Product specifications are subject to change without notice. Please contact eClinicalWorks Public Relations with any questions. eClinicalWorks V10 EHR is ONC HIT 2014 edition certified as a complete EHR. eClinicalWorks V10 CC 2014 955447-1.